Hi, I'm Dr. Greg Coleman, veterinary internal medicine specialist. It's been a while since I've published a video, but I had a topic that I wanted to discuss, and it is dogs or cats who aren't eating. A lot of my patients come and see me because they're sick, and the most common presenting complaint is they either have a decreased appetite or they haven't eaten in several days, or unfortunately some people wait and it's been several weeks or sometimes more than a month since they've eaten a real meal. I know how frustrating this is. I do, from a personal standpoint. When one of my own dogs or cats is not eating, it is very stressful. I have field-bred English Springer Spaniels. They're field trial dogs, athletic dogs. They eat like machines. I never have to worry about putting food in front of them and wondering if they'll eat or not. But in the rare times this does happen, it is very stressful for me. So I think the most important thing to remember if your dog or your cat is not eating is to take a deep breath. Don't let them feel your energy is what I'm trying to say. They very quickly will become food adverse. That's the number one thing that we want to avoid here. We don't want to take a medical problem that's causing, your favorite furry friend from eating or drinking and take that medical problem and then make it into a behavioral problem as well. That happens pretty frequently. So how do we avoid having, in this acute setting where let's say that your dog had just stopped eating regularly or at all, what do you need to do? Well, first thing you need to do is call your vet and get an appointment to go in and have a workup performed to figure out why they're not eating. The second thing is to just relax. I know this is very hard to do, I really do, but if they're not eating, just let them be. Don't try to force feed them, don't try to coax them into eating. These things will create behavioral problems that will only compound the current problem. So what I also don't want you to do is to feed them just anything that you think they might eat at that point. That can create problems as well, especially in smaller dogs. They like to get pancreatitis. If we feed them foods that are too fatty, we can cause a significant serious medical problem like pancreatitis. So please don't go buy a rotisserie chicken and start feeding that to them. Brown up some hamburger and just feed that to them. That can actually be worse. If you absolutely have to try to feed them some human food to see if you can get them eating, try to pick things that are low in fat. I like things like turkey breast, not chicken breast. Turns out chicken is fairly high in fat. Turkey breast, tilapia, pasta, just plain pasta, boiled, cooked pasta, no fat, low fat, cottage cheese. Everybody always says add rice. Most pets, especially cats, won't eat rice, but dogs will eat rice one time and then they won't eat it again, but you're welcome to try it. I like to call this the white diet because these are all white foods. And so try to remember those are a few things you can try to feed them while you're waiting to get that appointment with your vet. So that being said, so what we're trying to avoid is food aversion, and we're trying to prevent creating a very serious medical problem at this point. Please don't force feed them. We get so many patients that come to us where the owners have a syringe or they have some method that they're force feeding these pets. Find that very offensive, to be honest. And they will quickly get to a point where they're not eating because they're, for lack of a better word, they're scared to eat at that point. They're afraid they're going to get food shoved into their mouth. Especially at a time when maybe they're not feeling good. That's probably the reason that they're not eating, is they don't feel good. So getting food into them might only make them feel worse and make them feel sicker. So the important thing here is get that appointment with your vet. If your vet is booked out 3 weeks, not eating in either a dog or a cat, especially a cat, is a medical emergency. This is where you may need to make a trip to your local ER, so hopefully they can figure out what is going on, or they can refer you to a specialist like me who can figure out what's going on if it's a more complicated problem. Rapid medical care for a patient that's completely not eating, a patient who's anorexic, needs to be seen by a vet soon. With days is what I'm talking about. And when you get there, these workups, unfortunately, sometimes they can be a bit entailed. Sometimes you run some blood work and you figure out, oh, there's a kidney problem, there's a liver problem. Those are not what happens every single time. Sometimes we have to do blood work, we need to maybe do some x-rays to figure out what's going on, and ultimately we may need, an abdominal ultrasound to actually see what the intestines look like, what the stomach looks like. So, I hate to say it, but sometimes these can be, slightly expensive workups as well. But the good news is once you figure these things out, generally you can get a patient back to eating. You can treat the underlying kidney disease or liver disease and get them eating. Now, the important thing to mention here is that it is very rare for dogs or cats not to eat because they have dental disease. So the first step is not, my dog or cat is not eating, I should make an appointment to get a dental with my family vet, because that's probably why they're not eating. Dogs and cats will eat with dental disease that would make most humans, you can't believe how bad their teeth can be, and they'll still be eating because they have to, as long as they don't feel sick or nauseous. And that's generally what's keeping them from eating in most cases, if they feel some degree of nausea or illness. It isn't pain from dental disease, interestingly enough. I've seen cats with teeth that are unfortunately practically falling out of their head, and there's so much inflammation, and they're still just eating hard food, doing fine. So the dental is not generally the ticket back to eating normally. It's the medical workup to figure out what's going on inside of them. That is what you need to do. So the takeaways from this are, what I really want you to take home from this is, if your dog or cat is not eating, get an appointment with your vet. It's not a wait and see situation, especially with cats. Cats actually can go into liver failure. They can get something called hepatic lipidosis, or people will call it fatty liver disease, if they are not eating their normal amount of calories. Even cats in a negative energy balance, which means they're not eating their normal amount, can eventually develop fatty liver disease, which leads to liver failure. Dogs can go longer without eating. They can go longer without eating. If your dog or cat hasn't eaten in a couple of days, you need to get them to a vet. Please, at this point, seek medical attention. Don't force feed. And then the other thing that's important is, please don't, they can feel your energy. I'm not a woo-woo kind of guy or anything like that. They literally can feel your stress, and that just makes them want to eat even less. So take that step back, take them to the vet. Don't force feed them. And then be prepared that the workup for this problem may entail several steps before you get to the answer. Hopefully you find something simple, right away, but if you don't, this may take... And the other reason for getting to the vet as quick as possible is this happens all the time too. People show up for an appointment and they think, because they're there now, that you're going to figure out what's going on in 30 minutes, like a TV sitcom, and that everything is going to be back to normal. This is not always the case. Sometimes this involves more than one appointment, waiting for test results, sending out lab histopathology to figure out what's going on. And some of these things can take a week or two or even longer, depending on what tests are being sent out. So this is why I'd like you to get to the vet as quick as possible, and you can figure out what's going on, and you can keep the stress away from yourself, and most importantly, keep the stress away from your pets. So, all right, thank you very much for listening. Take care.